So, Margaret, and what is Alzheimer's disease?
Well, I think it's quite interesting. It's the first type of dementia that was ever described where you could actually see physical changes in the brain. And it was discovered by this doctor, Alzheimer, 1906 in Vienna, who found these plaques and tangles. It wasn't until the 1990s that they realized that the proteins involved are amyloid and tau. So they talk about the amyloid hypothesis originating in 1990. So there was all those years between discovering it and nobody really knowing what it is. But it is by far the most common of the dementias. We know far more about it than we know about any of the other dementias. And there are still lots and lots of things we don't know.
And does it start in the hippocampus?
Yes, that's
area?
right, it does.
Right.
It always that was knowledge gained much later on. And it was found from various research studies that it always starts in the hippocampus, which is the memory store. That is why memory loss is the most significant symptom of Alzheimer's.
Short-term memories.
Short-term memories. Long-term memories are stored elsewhere in the brain and seem to be maintained for a long time. And in fact, for a period, they become clearer.
Right, okay. And I've heard that from talking to people that sort of level of insight can sometimes be affected as well. People don't realise the changes that are necessarily happening.
So. Yes, I think that's very common. And we'll be coming back to that later with the mechanism of denial where some people are in denial. They don't want to acknowledge that there are any changes, but apparently there is a small percentage of people who literally don't know. They don't know that their brain is changing. They are sure it's everybody else's that's wrong and they're right, which makes life very difficult.
And what's is Lewy body dementia?
Well, Lewy body dementia is similar changes. A different type of protein builds up in the brain in a spherical shape, but also kills it. And it's very different to the other dementias. Memory loss is not really an issue. The most common symptom in up to 90% of people report is hallucinations and delusions, which means false beliefs, believing things that are not true. It's very closely allied with Parkinson's. There's a big crossover, and you will get Parkinsonian type symptoms alongside the Lewy body, and the two diseases sit side by side but are treated in separate pathways.
Right.
And it seems to depend on which was diagnosed first, which pathway you go. So if your Parkinson's was identified first, you're in the Parkinson's service. If the Lewy body dementia was identified first, you're in the Lewy body.
That sounds really complicated.
Pathway, which I think is not right and needs sorting out, actually.
Confusing for
people. Yes, very confusing. The other thing about the Lewy body dementia, which is really important for us all to know, is that certain drugs which are still used to sedate people with dementia, which are known as the major tranquilizers or the antipsychotic drugs, should never be prescribed for people with Lewy body dementia. They can, in fact, I think, be fatal. And so it's very important that drugs like haloperidol, clopixol, risperidone are not used if somebody has Lewy body dementia.
Right. So tell me about the different stages of dementia, Margaret Ann.
Well, it's just like the defining dementia. The stages is not that easy because of this thing called age-related memory loss. As we get older, we all lose memory cells, and our memory gets worse. And it's perfectly normal and natural and it doesn't mean anything other than that you're getting more forgetful about, and I must admit there are chunks of my life that I can't really remember in much detail. It's bizarre, but it's what happens. So how do we know with that, so you have the doctor has somebody of 85 comes to see them. How do they know that there is actually something wrong here? And so having done various elementary pencil and paper tests, usually in the surgery, they would then probably, if they think there is grounds for assuming that it is a dementia, they would then say this goes as a progressive condition, and it goes in stages. So the ordinary ones that everybody uses are early, middle, and late stages, or mild, moderate, and severe, depending which you like to choose. In Alzheimer's, this is a very, very gradual progression and can go on for, they reckon, is it 2 to 12 years? But I've certainly known somebody of 20 years who's had it. It can be a very, very slow, almost glacial deterioration. Other dementias, it's much more quick and much more up and down, because with Alzheimer's you know exactly where you are. You know just how the person is until the behaviour gets worse and you realise you're in a change point. But there are periods where you're on a plateau. However, there's this phenomenon called mild cognitive impairment. That means somebody goes to the GP with symptoms of memory loss probably, and they do one of these basic pencil and paper tests and discover that the person is not showing enough, hasn't got enough things wrong for a diagnosis of dementia, but there is clearly a problem. And I think in layman's terms you would say it becomes a problem when it interferes with your daily life. And that's when, in reality, when most families would get concerned. They would notice that their mother or father couldn't make a cup of tea, or they kept finding bunches of keys in the fridge, or things like this, which are not part of normal ageing. So it's kind of judged on the person's behaviour, it seems to me, very much.
I think so. And somebody said once that it's about the level of insight as well, that a person with, say, Alzheimer's symptoms might not recognise that they've got those symptoms, whereas, as you were saying, part of that natural ageing process, you might be forgetting things, but you remember that you've forgotten, whereas a person with dementia wouldn't remember that they'd forgotten something.
Yes, and I must say, I've seen this in myself. You learn knowing about what they call benign memory loss. I had an example where I'd been binge watching Stranger Things, TV series that was on during COVID with my granddaughter. And a few months ago, I could not remember the name of that series. I just couldn't. And then I thought to myself, just leave it, and it will come back. And of course it did, fleetingly. And then every time afterwards I made myself say to myself, the name of that show is Stranger Things, and I repaired it. I now could say it trippingly off my tongue, without me saying, oh. And that, I think, is the difference. That wouldn't happen if I had dementia. And so, and also that awareness, as you said, the insight. If a person has just got that normal type of age-related memory loss, they will just realise that that's what it is, and they won't fuss, and they won't worry, because it'll probably come back 9 times.
And because we all go into the kitchen and think, why did I come in here? And sometimes we all find our car keys in the fridge, but we remember afterwards why we did that.
Later why we did it. And the insight thing is really a very interesting point, because it is particularly trying and difficult, because families may be aware and the person really isn't aware that there's anything wrong.
Then it can be hard to get that person to the GP.
It can be very hard to get the person to agree and families have to adapt various strategies to get them there. And it's generally, it is a very difficult time. This is why we at TIBS don't insist on a diagnosis before somebody comes, because for one thing, the symptoms have to be present for 6 months before a GP can say this is assumed to be dementia. They can't diagnose it properly anymore. They are supposed to go to the memory clinic, but you have to have had those symptoms for 6 months before.
Right.
And so that 6 months can be really difficult for families.
Absolutely. And also, there could be other reasons, I suppose, why they say 6 months, because if you've been through a bereavement, or perhaps you've recently retired, or you're under a lot of stress, then you might actually display dementia-type symptoms.
Yes, oh, absolutely.
But actually, it's a different cause, or you might be depressed. So I can see how it's really difficult to actually, fathom out what's going on.
As well as the physical conditions, such as vitamin B12 deficiency or thyroid problems, or if you're an insulin-dependent, a type 1 diabetic, your sugars are all out of kilter. That could make you very confused.
Right.
So it's not a simple thing.
Yeah. And what about some of those later stages then that you've sort of mentioned? There's so you were saying mild stage, moderate stage, and later stage.
We mostly in our work are working with people in mild and moderate stages. Most people in late stage would be needing 24-hour care 7 days a week,
right,
which is virtually impossible to give without professional help. That may be given in the home, or it may be given in a care home more commonly. But at that late stage, you're really talking about palliative care.
Right.
Nothing's going to get fixed anymore. It's about lovingly caring for them and providing comfort. Yeah.
Okay.